Okay, so we get this question all the time, and it's probably never ending. We've got probably 20 videos on this, but we'll do another one. So G2 versus Gatorade. Propel versus Gatorade. Crystal Light, Diet Coke versus Coke. Okay, so we've got a couple of issues there. What should we be drinking? What's the best choice? And things like that. And we want to touch on some topics. Medicine versus health. Medicine versus regular foods. Sugar versus artificial sweeteners. And a few things like that. And try and bring that all together in under 5 minutes. Because you don't want to hear me talk for an hour on it, which I could. Don't dare me to do that, because I'll do it. Okay, first of all, Gatorade is really a remarkable development. Not because of Gatorade, but because of something that's the same thing as Gatorade called oral rehydration solution. When the advances in medicine for the past 100 years are calculated, many people believe that oral rehydration solution, which is a mixture of sugar, sodium, and potassium, which is equal to what's in Gatorade, may be the most important medical development of 100 years as far as number of people's lives saved. Because one of the big killers throughout the third world is something called cholera. It's a Vibrio cholera bug that grows in your colon and causes a massive watery diarrhea, which kills people. In other words, they basically lose their entire body's fluid volume out their bottom. That's what cholera is. A devastating diarrhea that kills you. And there are little kids dying in Kenya now because they're having some big battle over who's in charge in Kenya. And there are kids dying right now of cholera. And what they found is that one treatment, which kind of is a first world kind of treatment, is you start IVs and you give them IV fluid back. Well, in Kenya and lots of other third world countries, Bangladesh and India, when you get cholera, there aren't any bags of sterile saline. If they have needles, they're usually not sterile, and they're used in somebody else who may have AIDS. So they don't have access to treating those people with IV fluids. So what they found is they can just give them back what they're losing, which is basically sugar, sodium, and potassium. And if you do that, you'll save millions of lives. So oral rehydration solution has saved millions and millions of lives. Okay? And they've tested it. More salt, less salt. More potassium, less potassium. More sugar, less sugar. And the perfect match is called Gatorade. So for our patients post-op who are going to be dehydrated and weak and tired after the surgery, the best medicine to rapidly resuscitate that person or a cholera victim in Kenya is Gatorade. Okay. But there is sugar in it. But the sugar is to be used as a medicine to resuscitate you when you're dehydrated. Now, as a quick aside, why are our patients dehydrated? The surgery itself causes massive fluid losses as a therapeutic treatment after the surgery. The surgery itself causes you to lose your swollen ankles, your high blood pressure, the fluid in your skull causing headaches, the fluid in your lungs causing breathing difficulties. So the surgery is very powerful, but it actually can overdo it. And to replace that and to keep you from passing out from dehydration, the best treatment available to have with you is not G2, it's not water. In other words, if you went to Kenya now with G2, you would kill a lot of people that you could otherwise save. The saving concoction that works best is Gatorade. So when you feel weak and tired post-op, have you run into this yet, where you get the little weak and dizzies at the end of the day? Or
just once, the whole time.
Yeah. The solution that best resuscitates our patients is Gatorade. Now, then other people say, well, I'm drinking Gatorade all day, every day, and it's got a lot of sugar in it. And there we would agree that lots of sugar from Gatorade is just a regular drink is not necessary and not valuable. So Gatorade as a medicine, spectacular. Gatorade as a foundation of your diet, there's a lot of sugar in it, so it's not a great choice. Gatorade as medicine, terrific and valuable. And say a couple of our patients work outdoors in the sun in Las Vegas in the summer. Okay, I have a guy who's 7 years out after surgery. He works for the department, of transportation outdoors on the big road grading equipment, and he has to kind of change the tires on like these road graders and stuff like that in 120-degree heat. And when he was 360 pounds, he could just lean on the pry bar and he'd pop that lug nut. Now that he's 170, he jumps up and down, nothing happens. He's got to get help. But anyway, so he works out outdoors, sweating like crazy. He drinks Gatorade all day, and it works great for him as a resuscitation fluid. Now, let's suppose your job is sitting. We have a woman who works in the Henderson Police Department as a dispatcher. Okay, well, that's not like being outside in the sun. So she doesn't need to drink Gatorade all day long. If she wants to drink some occasionally, that's okay.
I think this is the concept I'm probably not working with, is the amounts we're talking about. Like this, how long has that been that empty? I'm not sure what does it take.
Right. I got a phone call about that yesterday, and so the patient said, "How much?" And I said, "Well, turn it around and imagine you are an owner of a car and you're calling the car company and saying, how much gas should I use?" You can't answer that, can you? Because it depends. How, are you driving the car every day? So again, back to my example, let's suppose you work outdoors in the sun in Nevada in the summer, or you work indoors in the air conditioning, and you hardly get up and move around at all. So the amount of Gatorade that you need is directly related to how much gas you're burning in the car. Now you might say, well, in my car I have a fuel gauge, so I can tell. And in your case, post-op, you will have a fuel gauge as well. All you have to do is stand up. If you stand up and you're kind of a little weak and dizzy and tired, it means you're low on Gatorade. And if you get up and you're weak and tired, G2 does not replace that nearly as quickly or as well. So my guy who's working out in the sun does not drink G2 for his resuscitation, or his workout in the sun, and I don't recommend it. On the other hand, let's suppose you're sitting down and you're just drinking Gatorade all day long with iodized sugar in it. It can hurt your teeth. So you have to say, do I need this as medicine? In which case, Gatorade is the best choice. If you're not taking it for medicine, then I'm not crazy about G2 or any of the other drinks, because I'd prefer you to have orange juice or grapefruit juice or something healthy. Now, I want to tell you one added story about why I prefer the orange juice over G2 or something like that. And I'm going to give you a different video for this.